So the social factors that affect obesity are numerous and include your gender, your race and ethnicity, your nativity status or immigration status, socioeconomic status, which is usually measured by your income, your education, your occupational prestige, as well as neighborhood characteristics that you live in, social networks or individuals that you spend time with. Hi, my name is Gabriele Ciciurkaite. I am a medical sociologist and an assistant professor in the Sociology, Social Work, and Anthropology department here at the USU. In Lithuania, I grew up in a very weight-conscious family. My parents were always very sensitive about their looks and their fitness levels, and they always seemed a little bit judgmental of people with larger body sizes. So all of these ideas and perceptions became ingrained in me. So when I moved to the United States and I became more aware of a larger variety of body shapes and sizes, this really made me question how much of an individual responsibility obesity really is. In my research, I primarily rely on large government-funded data sets. NHANES questionnaire is very extensive and includes questions regarding demographic information, health behavior such as individual diet and physical activity, sleep patterns. They even ask questions about childhood experiences. They also include questions about psychological and emotional well-being. They measure individual height and weight, which is great because we know that self-reported weight and height is not always accurate. They also collect blood and urine samples for various measurements. One of the social factors that affects obesity rates is the neighborhood that you live in. There are a number of mechanisms through which neighborhoods can affect obesity risks. So one of them is food deserts. Food deserts are geographical areas where access to grocery stores that sell fresh produce, not processed foods, is limited. And if you have limited access to grocery stores, you are more likely to rely on convenience stores and fast food outlets where food is high in sugar content, high in salt content, and also more processed. Neighborhoods also vary in their access to built environment, such as sidewalks, bike paths, and as well as recreational facilities and parks. And it's difficult to be active outside without those resources being available. For racial and ethnic minorities, even with higher incomes, their money doesn't go as far in terms of the neighborhoods that they can afford to live. Experiences of racial discrimination is another factor. Discriminatory experiences are considered a chronic stressor, and some research suggests that prolonged experiences of that are associated with a risk of obesity. Based on a manuscript published by Nicholas Christakis and his colleague, your risk of obesity increases by 57% if your friend became obese. If your sibling became obese, that risk for you would be 40%, and if your spouse became obese, that risk would be 37%. So obesity can also spread through social networks. I would like people to walk away knowing that obesity is not just an individual's responsibility. Choices that we make every day and our decisions matter, but our ability to make the right choices depends on the access to resources that allow us to do that. My research findings help parents and other caregivers understand the things that they can change in their living environments to improve their family members' health. Social science research findings will help policymakers and public health officials create interventions that target more than just individual level behavior. Evidence suggests that weight loss interventions are largely unsuccessful. All the weight that individuals lose, they tend to regain that. And even though losses are generally fairly modest, the same goes with diet. So really the only interventions or prevention efforts that work have to target broader social factors and the environments that individuals live in that would make it easier for them to make healthy life choices and to be physically active and to choose the right foods. I teach an undergraduate medical sociology course, which is largely attended by pre-medical students. The MCAT examination that a lot of them have to take before gaining entrance to medical school now includes a part of sociology, which means that the medical field is finally taking notice that social factors and understanding them and how they relate to individual health is important. So I teach them about social determinants of health. I teach them about the history of the medical profession, physician-patient interaction, the healthcare system in the United States. Health problems that the majority of individuals face now are chronic issues. That means that the role of the physician, they just have to understand better the social and economic conditions that their patient is coming from, including their family environment, their home environment, perhaps their cultural background, their language background, their religious affiliation, because all of these things affect the extent to which we are going to be able to take care of our health. For instance, when I lived in Lithuania, we took our family meals, or we considered our family meals to be an important time to get together and spend time with each other. My parents never allowed us to watch TV while we were eating, which my experience, of course, was very different when I came to the United States, where a lot of meals are taken on the go, in the cars, in a rush, without really sitting down and appreciating it. I love the American fast pace of life, and I love the unhealthy eating and snacking and getting Starbucks, and I consider those treats in my life, even though it does make your relationship with healthy eating more challenging. People gain weight when they consume more calories than they expend, so of course individual choices matter. However, individual responsibility can only take its full effect when people have access to resources to live a healthy lifestyle.